The TacMed Simulation Clinical Response Whole-Body System is a highly durable, high-fidelity patient simulator designed to meet trauma training needs from point of injury to the trauma bay. Head to toe, the clinical response has unparalleled realism with light reflexive eyes and an anatomically accurate airway. Nasal passages can be obstructed to train routine and difficult nasopharyngeal airway placement. The clinical response's pliable jaw supports jaw thrust and chin lift maneuvers. Removable injured teeth simulate airway obstruction, and a censored and anatomically accurate lower airway supports laryngoscopy and endotracheal intubation. Sensors reflect nasopharyngeal airway placement and tracheal intubation on the remote control. Neck and underlying anatomy support cricothyroidotomy training, and the clinical response system is responsive to bag valve mask ventilation with chest movement and matching physiology with bilateral breath sounds. Learners can perform CPR with appropriate anatomic landmarks for hand placement and with CPR feedback on the remote. They can also perform intramuscular injections as well as intraosseous needle placement in the tibia and shoulder and sternum, which will all accept fluids. The clinical response system is designed for advanced chest procedures, such as finger thoracostomy and full chest tube placement bilaterally. Learners inserting a chest tube will feel a pop through a replaceable pleural membrane, and the chest tube can be sewed in place with standard sutures. The clinical response system is equipped with multiple pulse points, all of which respond to physiologic blood pressure, so as blood pressure drops, distal pulses are lost. Blood pressure can be measured on the left arm with a manual cuff using carot cuff sounds with a standard stethoscope or visually on the pressure gauge. Intravenous access points on the arm provide realistic flash and accept fluids. The clinical response system simulates tension pneumothorax with unilateral chest movements, increasing respiratory rate and decreasing oxygen saturation. Needle decompression can be performed bilaterally at the second intercostal space, resulting in an audible air release feedback and remote control notification of task performance. Vital signs and breathing respond appropriately after needle decompression is properly performed. The clinical response is also equipped with pelvic crepitus, suggesting pelvic fracture. The left groin has a realistically bleeding, packable arterial bleed with sensors that capture the pressure required to stop bleeding. Realistic movement of the leg and a traumatic amputation on the right side support tourniquet placement, calibrated to respond when appropriate turns on the tourniquet create sufficient force for bleeding control. Female anatomy can be added to create a female appearance. Both male and female anatomy are available for bladder catheterization that results in fluid feedback when properly placed. With accessories like the vital signs monitor and leg and arm adjuncts, it also fully supports advanced cardiac life support curriculums. The Clinical Response Whole-Body System is the mannequin of choice for training from point of injury through critical care and prolonged field care scenarios.